but the rewards have been immense and great. So as Hannah was saying, I want us to start off by actually getting this opportunity to talk about the things that are really difficult for us as journalists. I'm not necessarily speaking from a safety point of view, but I'm talking about that notion of having to come up with new ideas all the time, being whether you are a freelance journalist, which sometimes makes it harder because you've got to keep on pitching stories. There is also the other form of journalism where you are working for a particular media outlet, and that also has difficulties. So I thought, let's pretend, seeing that we are so far away from each other, we can see each other, but let's pretend that we're all in the same newsroom, okay? And we all have a break, the deadline, or it's the end of the day, and we're sitting and we're just having a nice big fat moan, all right? And also to talk about the good things that have happened, maybe a story that's written that's really inspired you and made you feel, okay, I can do this. And maybe things that you've learned through the pandemic. So I think, Hannah, we can maybe then go to Tebi and ask Tebi to give some of her experiences, and of course for everybody to chip in. So if you hear something that you feel, oh my goodness me, that's exactly what happens to me, then let's chat about it. Let's talk about ways of maybe solving it and maybe giving ideas and tips about how you can get around some of the frustrations. So Tebi, welcome, and thank you for giving us an indication of the challenges that you experienced.
Thank you very much. Hi everyone, it's evening here in Nairobi. So when COVID-19 in 2020, it started on, I would say, a bad note for me, because first I lost my job just when the first case was reported in Kenya. And that's how I started freelancing with the onset of COVID-19. So, well, I thought of being a journalist, I was not going to sit just in the house. And then now I said, I love to start telling stories. So I started reaching out to different publications, the Insider magazine that's based in South Sudan. And then I also reached out to Talk Africa publication, and they started publishing my stories, though on a slow motion because it was taking time reaching out to the editor whom I did not build network with. And here I was reaching out to them with first pitching the story idea and also introducing myself to them and showing the interest that I would love to write for them. But it was good because both the publications agreed and they started writing my articles, publishing my articles, though with the back and forth, because I was in radio. So transitioning from radio to print was also not easy. And then I had not specialized. So with COVID, everyone was switching to health writers.
Right.
Writing about science. And then, I used to write more stories on education. So that also came with the challenge, trying to get into the science world to tell these stories, and also from broadcast to now print. Again, those challenges were not easy. But then, fortunately, with the restrictions on COVID-19 that most things were taken online, gave me that opportunity now to interact with different people. So I kind of found myself a Zoom person, always in the Zoom meetings and there.
Exactly. I love that story about, sort of there's two big things that happen to you. And it's an amazing thing because you have to just get up for the challenge. One, was this thing of not having to become freelance, just like that. Two, you have to make yourself heard. So you've got to pitch to people that don't know you. So it's the trust factor. Once you're in, you have proved yourself, then they'll come back to you. So there's that risk always. And then that transition from being a broadcast, which I have to tell you is what happened to me. I went from broadcast to print, and it is kind of different, but they do help each other a little bit. And then any kind of reflections about some of the issues around this continuing pandemic story? I mean, has it been difficult to pitch some stories to editors who may feel that, we're bored now?
Yeah, I remember first there's an editor for Foresight Global Health. magazine I reached out to, and they liked my pitch. It was around misinformation.
Mm.
And I had the challenge of giving it the global angle.
Right.
Yes, because now Fawcett Global Magazine is not just for one country. It's I had to bring out the global angle, and that was really a challenge. Mm-hmm. Fortunately, we did a collabo to write the story. So I gave the African angle, and my colleague gave it the global angle, and we managed to share the byline. And fortunately, the story was published.
Yo, Tibby, that's a fantastic, that's so interesting, because what you're showing to me there is that, you know, what the pandemic has shown us in some ways is that we might think that we are separated, okay, but what it's really taught us is that we are part of this global village. But what is important around this is the ability as a writer to think globally, and that often, you know, yes, does mean that you actually have to do more reading, because it's not just about knowing about what's happening in your own country nationally. You're going to have a much broader thing, a broader understanding. So, but that's such good learning for you, because it means also that you develop as a journalist, right? And it means that you could pitch then again to other global media outlets.
Yes. So excellent. The other thing that also worked for me was joining a network for science writers. I joined those, and that's how I now know Christophe, though we've never met. But okay. The Zoom world has brought us together. So.
Okay, but yeah, that's just also a very lovely illustration about that we might sometimes feel that we're on our own, sitting at home, trying to find sources, feeling like, oh, who am I going to phone next? But actually, to become part of a network, okay? So that's a very important thing as well, is to become part of a network of journalists, because we learn from each other.
So the other one, before I take a break, the other challenge was also, you know, I belong to different professional WhatsApp groups. And in one of the WhatsApp groups where it's network for media and PR women, there's a lady who shared a story of a certain lady who had delivered. She is deaf. And so the lady had difficulties on how she would be helped to get out of the hospital. So in the group, people contributed, and then I thought, oh, why would I contribute when I'm a journalist? I need to tell this story. So fortunately, when I reached out to the lady who came up with the idea, and I asked her, I'm not able to contribute financially, but I want to share the story of this lady who delivered in a public hospital and has challenges of someone who can help her, and also she's deaf. So all that challenges that she's going through. And the lady agreed. So I did the story with her helping me with the sign language interpretation. So fortunately, we did that story, highlighted it, and reached out to different organizations that are dealing with people with disability here in Kenya. And that story won me an award in the Annual Journalism Excellence Awards by Media Council of Kenya this year in May.
So what I love about that story, okay, is that there was something in that story that gripped you, okay? It spoke to you, isn't that so? Yes. And then you, being a member of a community, understood that that story would grip other people.
Yes.
You know, and it's also that what needs to really take opportunities when you can see it. And I think what makes the difference between a journalist who is maybe not really keen on journalism and one that is keen on journalism is it's around passion, really. And it's around recognizing what is a story. And it's also about recognizing what your audience wants to hear. And I guess most of the time, our audiences want to hear about themselves. They want to hear about people that are in their communities. It's not always about the politics and the you know, at the top and blah, 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 blah. It's actually about the things that matter to those people. So that's just amazing. Yeah. And can you tell me any more about any frustrations that you had particularly? There's actually a
First,
story. Sorry, there's actually here a question in the chat to Tebby. What do editors basically look for in a COVID-19 story pitch? Can you tell us?
From the experience, I've noticed all the stories that have human face in them. The editors love them. I've noticed the stories I did pitch without bringing out the person I want to put in that story. The pictures were not accepted. But for those particular ones that I'd say indicated, like, I know of this person who is going through this, and this is the person I want to walk the story, and also bring out the gaps that are missing in terms of governorship. They made all, and they were all published. The pictures were accepted, and I wrote the stories, and they were published, and also they helped me to get to different government offices that I'd never gotten to before.
It's really, really interesting. Now, I wonder if there's anybody out there that has had a particular frustration, because it sounds like, you know, that you seem to have managed pretty well, actually, but you've had a lot of difficult parts in your journey. You could have given up very early on, right?
Sure.
You could have given up at the stage where you had to transition from going to radio to print. You could have given up when suddenly you had to become freelance. Do you know what I mean? Because they can be big frustrations. You could have given up because it might have been so difficult to find a story to pitch to. So I want to also ask, in a time of what I think we are tired, let's be honest, it's exhausting. This pandemic has been exhausting on us as, for example, having to learn new fields of research, having to really get an understanding so that we can translate that information for our audiences, trying to find the right sources. I know for me, okay, one of the things that I really hate, okay, when as a journalist is not being able to get in touch with people. Do you have that experience? Who do you have that experience with particularly?
First, my challenge was getting the terminologies, understanding that not all scientists can address health-related issues, and then starting to know there's even science is also broad. So there's a particular scientist who will be able to respond to particular issues. And then that not all the updates on COVID-19 by Minister of Health are news. People got tired of them. Like everybody was already knew that at a particular time, Cabinet Secretary for Health will talk about the number of positive tests, those who have been tested. So people really got tired of that, and so people wanted to listen or read different stories. And so it also worked well for me, because as a freelance journalist, I don't write hard news. I do feature stories. So it was a nice opportunity for me to pick ideas from the daily updates and see how to build them and bring new angles into those stories. And like now, people are getting tired of stories around COVID-19, but we can't say we're not going to tell them more stories. It's now time to look at the success stories that will even, for example, make people who have never gone for COVID-19 tests, who have not accepted the jab, to get the jab. Like we know during COVID, when at the onset, most youth were really against the jab. Chances are most of them have not agreed or have not built trust into the vaccine. So this is the time to look at those youth who have gotten the jab and didn't get any side effects, as was spread through misinformation, so that they can feel like, yeah, 2 years down the line, these people went for the jab, they're still alive, they're doing well, they're just still putting on face masks. So this is going to also help people build trust and and as journalists, bring new angles into the stories we are telling.
That's wonderful, because it actually makes me think about something that I want to talk about later, because we've got to think all the time as journalists. Listen, you know, we have to keep stories alive and we have to think creatively. So what I like about what you're saying is that there is definitely a difference between a news story, a news journalist, okay, that's basically following the news like a hound, okay, on top of the latest developments all the time, and then a person that is a feature person that can actually sit back and then look at the developments and then look at a way to tell the story in a different way. Now, I'm just wondering, Tibby, I can't remember, Hannah, if we have somebody else who was going to tell us some of their experiences, so please just let me know.
I have a few questions from journalists. So I'll fire like 4.
Okay.
There's one who's asking, can Tebi tell us the manner used to succeed in contacting the woman up to publishing her story? And then that one doesn't have a name. It's from Galaxy A5J. And then there's Josephat Mushiri from Transworld Radio, who asks, how do I convince church leaders of the existence of COVID-19 despite their faith? And there is also Ruth Mayoro from Bus Radio, who asks, how do you convince a source who's had COVID-19 before to talk with you? And allow me to ask one more from Annabelle Loholong, who asks, what can a journalist do in remote areas where there's a lack of information about COVID-19 and no access to health facilities? Thank you.
Wonderful questions, everybody. Okay, so Tibby, are you going to, I think the first question was about how did you manage to be in touch with, I think it would have been the woman who, who was deaf, if I understood correctly. You know that story that you told us about? How did you meet her and how did you establish her as a source for your story?
From when one of the colleagues did share the story in the WhatsApp group, I saw to her it was the need to have this lady help to get out of the hospital. And I thought there could be more than her in the same situation. So telling her story will help, will bring interventions. And so I reached out to her. I went to her inbox and I took her number from the WhatsApp group. Then I called her, I said, I've seen you asking for people to come and help you with the donations to help this girl. But I'm requesting that you help me, you connect me with her, I do the story and share. So it's through her that fortunately she agreed. And so we agreed, worked on a day and went to meet the lady. So actually this story, I shared it twice. I first told it once, just sharing how the challenges, how a group of women have come together to help this lady get out of the hospital because she didn't have anything, despite having delivered in a hospital, in a public hospital where she was not supposed to pay any bill. But after about 6 months, I did a follow-up story again on that. So this is where now I brought the gaps for people who are living with disabilities, especially the deaf.
Right. And then I want to ask you a follow-up question. First of all, I just love that idea that you followed it up, guys. This is very important. You know, we don't just do stories and then, you know, I think that there's a bit of a responsibility that comes from us in terms of our audience. We don't just break a story and run away, or we don't just say use somebody as a source and then run away. We go and do a follow-up, because a follow-up can also just be as much and as powerful as the first story. Now, I want to ask you, Tibby, did her circumstances, because remember, there was looking for help, isn't it? Through your stories, did that enable some relief for her in any way?
Yes, there's an organization that that came up, and now when I did the follow-up story, through the organization, I realized that it was not only her. So this organization had offered help to about 26 deaf women who had delivered during COVID-19, and they were all the 26 were deaf.
Right. So she then was able to get more resources and help and so on. So this is a beautiful story, because what it's done is that it's actually made a difference to somebody's life.
Sure.
And honestly, let's be honest, Tibby, did you not get involved in journalism to make a difference? Yes or no?
I
Aha.
did, yes.
Yes, exactly. And it must have made you feel really good when you did make a difference.
Very, very happy. And even
There was
when
your-
now the story won an award, I was extremely happy.
I'm sure. That's really wonderful. Okay, so the second, the thing about that, everybody, like finding these stories, I think it's got something to do with having, we're journalists when we wake up in the morning, when we have our breakfast, when we have our lunch, when we have our dinner, when we go to bed, we're constantly journalists. It doesn't switch off for us. So it's that ability to see something as a possible story. Now, Tibby could have just completely ignored that WhatsApp. Okay. But what happened is that she went the step further and a step further. And that is how journalism and excellent journalism works. All right. It's about having the curiosity and the desire to actually make a difference that takes you forward. So that, I think, explains that. I think the other thing there was about the church leaders and about how do we convince church leaders that COVID-19 exists. What do you think, Debbie?
From the perspective in Kenyan angle, I've seen different church leaders also want to work with journalists. So we can tag along those specific church leaders who really want to work with journalists and tell the stories. Because if we just have the blanket conclusion that we have church leaders who are against the vaccine, against the science behind the vaccine, it's not going to work. And then as journalists, we look at those people who can tell different stories, because we know news is not everything. So we can work with those leaders, even if there are two, wherever we are, and use them to tell the stories the best way they are. Like in Kenya, we have a church union, I will check the name again, that always invite media for press briefings. They will say, we have this, they will be like, now we are back to church full capacity, but we are advising our congregants to remember to put on their face masks. So these are best ways of telling the stories by bringing the church leader voices in our articles. Yeah.
Yes, and I totally agree with you. I think it's like you go with those people that are willing to, I mean, there are lots of church leaders, there are lots of different kind of religions and so on. And honestly, you're not going to win over everybody. It's just not possible, because there are a lot of religious leaders that will be absolutely adamant. So I'm not going to, certainly as a journalist, spend my time trying to convince somebody. I'm going to go because it's one individual. I mean, if that does happen, wonderful. Okay, then one can talk about the story about how somebody changed their minds. That's a great story. But I'm not going to spend hours and hours and hours and hours on like hitting a dead horse. It's not, there's no point. I'd rather spread the positive message and say what religious leaders are doing, those that are actually encouraging vaccination and so on. So I think that's an important point. And then there was something about sources and COVID-19. And do you think I can remember? Okay, I'll need
How do you convince a source to talk to you, a source that has had COVID-19 before?
Okay. Who's had COVID-19 before, and you want to interview them. What do you do, Debbie?
I'll share a link here shortly. And I will say I've never had difficulties in interviewing these people. I think first it's the approach, how it happens. But in my case, what happens, I just reach out to someone through WhatsApp, and I introduce myself and I tell them I'm interested in telling your story because of 1, 2, 3. Probably because one was in the hospital for long and thereafter they got out of it, or looking at the treatment cost, they had huge bill. So I tell them, I just want to tell this story. I'm not here to help you pay your bills, but just to tell the story, to bring out the challenge. And because we tell stories, we don't only do narrations of a person, an individual. So I also bring that out to them, that through you telling me how much you spent or the total bill that you had after being admitted in the hospital, And then was it easy for you to pay? How did you manage to pay the bill? Then through that, it connects me to the other people I can bring into the story. And on that note, I will just post a link of one of the stories that I did of someone who suffered COVID-19 and had a huge hospital bill after that. And then the other one is the positive story around vaccination. So asking someone who has ever gone for the vaccine to tell me the story, the experience, and the motivation behind them going for the vaccination. And someone who has not gone, also just asking them, why are you finding it difficult to go for the vaccine? Because I always say, as a journalist, we cannot jump into conclusion by judging people before we talk to them. Right. So I will bring, yes. So in that story, I bring the difficulties. If probably is not around a health facility that has the vaccine, I bring that out so that Ministry of Health can know that specific areas people are not getting vaccine because they cannot access them.
Exactly. So there, when we say, how do you convince a source? So what I love about what Thembi's telling us is that she's talking about what, if you've had COVID-19 and you landed up in a hospital, what was the experience? Because if you tell me about your experience, it makes me feel that others are experiencing something similar. And if others are experiencing something similar, what does that say about the health system? What does that say about access? What does that say about treatment that people are getting, say, from the health workers? What does that then mean in terms of the Department of Health and what it's doing for ordinary people? And boom, you've got a story. So I think that those things are very important because, you know, it's about little building blocks. We have little bits of information, and if we can say to a person that's had COVID, listen, from what I understand, you had a terrible experience. People shouldn't be going through that experience. You know, let's look at this. Let's try and help me work together with this by giving me your story so that I can see maybe others have had a similar experience, and then we can take that to the Department of Health. Now, you know, you also may have somebody who is really, really unhappy about being in the public eye. Now, we as journalists know that you can actually use somebody else. You can take a name and you can use another name for that person if they're very unhappy about it. And that's completely acceptable in a situation, very much so in, you know, sort of in journalism. We do protect our sources. And if this person's story is so good, but they don't want their name in it, then we say in the story, this person did not want to be named, so we call them whatever, right? And that's how you get to tell your story. But these issues about money, about lack of service, lack of access, these are ongoing stories that have to be told. All right, and then we had the story about remote areas. I mean, it's just devastating when I hear this sort of thing about how to tell a story, Thembi, from remote areas where people don't have access to health, nothing. What would you do, Thembi?
First, I think in the remote area, the best way to tell the story will be through radio, but then it should not be telling the frustrations. It should actually call to action, call leaders onto action. And sometimes I think it will not even be like journalists really want to write a story for people to read, but who are you targeting with this article? Everyone is going through the challenges. There are no health facilities. So you play the advocacy role of a journalist. By bringing out this challenge. You know, like in journalism, we say you have to be specific. So what specifically do you want to come out? Is it a health facility that is not there, or is it the drugs that are not there, or they are the health care who are not there, so that these ones can come out and you take it to the people who really will handle it. For example, if there are the facilities that are not there, get one person who is like maybe has an accident, a woman who is about to deliver, going through the difficulties to deliver, and then work with them in this story and then paint the picture of how long this lady will walk to get to a health facilities. And if that did not happen, what are the difficulties that they went through. And then from there, now you don't stop. You have to make sure that you've gotten to the nearest government official who can comment on that story. Because I know reaching out to government officials is like indirectly telling them there's no hospital here and you have to bring it here.
Yeah. So you know, even like what I would do, I've done this in the past, right? In my journalism stories, is that when I hear that sort of thing about a remote area, and I think to myself, okay, well, how would I handle it? I can already see 3 stories in my head. The one story that I would do, okay, is to follow an individual. So I would stay in a place nearby, and I would say, please, can I just follow you during the course of your day? And let's say, for example, that person has, just for argument's sake, a health issue, like a communicable disease. So let's say, for example, there's a lady and she's got diabetes, okay? I want to follow her through the course of her day and to write about what it is like to be her, from the moment she wakes up to the time she goes to bed. So I want to know what she has to do in her life to keep going and to stay alive. Then I want to do, if there is no health facility, then I want to say, well, there's no health facility here. To be able to get to hospital, she's got to get into a taxi and she's got to pay the money for the taxi, and I want to follow her. So it could even be a story where you start like 9 o'clock in the morning, this is what happens. 10 o'clock in the morning, this is what happens. Today she's managed to scrape together some money to go to the hospital. Then you follow her to the hospital and all of that sort of stuff. Then the story becomes, okay, what services are needed in the area and what services are people not getting? It could be a comparison between one area and another, because maybe one region is being way more serviced than other regions. So why is that the case? Then you talk to the local chief, okay? You talk to the municipal officer. So the story, and I mean, that is an award-winning story, I can tell you that now. That's an award-winning story. Okay, so Tole, can you please just tell me, are there any other questions before we move on?
Yes, they are. Okay. Thank you very much, Gideon and Ida, for your comments. Thank you very much from Ivory Coast. So I have Ruth Banda from Patauke Explorers Radio, who asks, how will she convince people who still believe in myths, especially in the rural areas? Allow me to ask a few more. Sarah,
I didn't get that. People that live in
how do you convince people who still believe in myths? You know, myths, rumors, misinformation, especially in the rural areas.
Yes.
And then we have Sarah Mawerere, who says, how can I continue convincing majority of the population that COVID-19 vaccines can help a lot when even those that have been vaccinated are falling sick of COVID-19? And then we have, we have Bebe, who asks, what can we do as journalists to tell the COVID-19 story more effectively? And finally, for this round, we have Muchaneta Chimuka from Zim Papers, who asks, since you're all journalists in the panel, what are the challenges that you have faced as media practitioners in covering this COVID-19 story, and how did you overcome them? So for this round, you will take those. I have a few more that will come later. Thank you.
Okay, I think we're going to be running out of time. I can see that already. These are wonderful questions. All right, let's see how we're going to proceed. I think when it comes to misinformation, I'm just going to give you a short answer here because we do have many questions. And I think that what's important about this here is that to be able to counter misinformation, we as journalists need to be informed, right? So that means that we need to know the answers. So if there is misinformation, we can only counter that if we have the correct answers. We can only counter misinformation if we actually listen to what people are concerned about. Some people are giving misinformation or are spreading misinformation because they don't understand what the issues are. So sometimes it's not malicious, it's just that they don't have the information. So I would argue, and it's just a very short answer because there's a lot to it, I would argue that we continue doing our job, giving the correct information, using the correct sources, and making our stories readable or listenable or viewable. We need to do stories through individuals. I mean, you could do a story about somebody that has, because of misinformation, has become sick or it has led to harm in their lives. So that's what I'd say just briefly there. About COVID-19 vaccines, it's my same argument. My same argument there is we need to know how vaccines work. We need to think very hard about what is it that people that are not getting around COVID-19 vaccines that they need to understand. I'm not going to delve into that very more deeply because I'm trying to keep up with the time. And then there was this thing about, especially around the issue of the problem, yes, and I understand that completely because it just sounds weird, okay? We say take the vaccine to prevent getting COVID and boom, people that take the vaccine can get infected. So it's very hard to explain that to people because A, it's true, but there's a number of things that we need to add to that story, right? And that is that no vaccine is 100% effective. We knew this right from the very beginning. No vaccine is 100% effective. We knew shortly after the very beginning that we've had variants, okay? And variants make the vaccine less effective. But the point about being reinfected, okay, is that if you have been vaccinated and you get infected, right? So you've been vaccinated and then you get infected, what actually happens is that the amount of virus that stays in your system is less than the amount of virus that a person that's unvaccinated will have. And that stays, and the virus stays in your body for a lot less time, which means, okay, that you will not transmit that virus to somebody else as if you were unvaccinated. So you are protecting somebody else, number one. Number two, the vaccines, while they are not 100% effective against infection, they are pretty much 100% effective against hospitalization and death. So what I'm saying to you here is that it's the science that you have to understand, and that is what you need to be able to explain to your audience. So that's why you've got to keep on writing the stories, because the story is not over yet. I think that final question was, we're running out of time. That final question was really about COVID-19 and us being journalists and what kept us from telling the story effectively. Is there anybody out there besides Teddy who's done such a wonderful job? And I mean, she's really now can afford the time to listen in a little bit. Is there anybody out there who had a serious problem with an editor, or that, you know, sort of there was something that really frustrated them and they didn't know how to get around it? Is there anybody that could please unmute themselves and maybe suggest? And in the meantime, we can maybe get on with another question, Tole.
Okay, so there's a question about sources. You talked about government sources, and a colleague from Ivory Coast is asking, how easy is it? Because it seems it's not very easy to get government officials to comment on her stories. And then there's a question from Martin Mawaya from Zimbabwe, who's asking, how do you balance gender voices in your COVID-19 stories? And Okay, let me see. There are some questions here about the vaccine. Someone's asking, his name is Dadson. It's similar now that the interest is waning. How do we keep the interest in our audiences with regards to COVID-19 stories? And then finally, somebody's asking, is Africa getting the vaccines at the same place as the West? Thank you.
Sorry, would African countries?
African countries procuring the vaccine from the same source as the West.
Okay, all right. So I'd like to take those last two questions into the last 15 minutes, and I'm going to have to rush through that. About creating interest, and then also the question was, yes, about access to vaccines. Just very quickly, Tebi, can you just tell us quickly, what do you do when government responses, when there's no government response? How do you get them to respond?
First year, before we tell the story, and thanks to the fact that I work on feature stories, so it's easy to send to request for that information. So I write a letter and I take it to them, leave them to contact me. If they don't, and by the time I'm working on the article, I'm expecting them to give me feedback. So if they don't, I do my story and I indicate that they didn't give me that information.
Absolutely. That's exactly what you do. And if it's a news story and it's urgent, I can tell you something, that one of the journalism practices is that you give them 24 hours. Okay. And when it comes to radio, because of breaking stories, you can actually say that there was no response at the time of broadcasting, because government officials, if they're not there, that I'm afraid to say, that is their problem. And if it is a controversial story, believe me, they will come. They will come. So you do the right thing. And the right thing is that you give them the questions, because sometimes, I mean, I just get so irritated. I promise you, they give me more gray hair than I've got. Okay, when they say, please write down your questions, and then you write down the questions and then they don't come back to you, and then you wait and you wait and you wait, and then you try and do something else and they say, no, you can't go this way, you've got to go through the right channels. And oh my word, I'm sure you all know what that's like. So I give them 24 hours. If it's like a feature story, for example, or it can wait until the next day. If it's a broadcast, then my suggestion is that you go without the comment, but you have to try. Because you got to think, like, if there was a court of law and they say, but you never got hold of us, and then you've got to prove that you did try. Okay, so that's important. Let's go to balancing gender voices. How do you balance your gender voices in COVID-19?
First, with the sources, I'm always keen. If my previous article, the main character, the main source was female, I make sure the next article I'm writing, the main source is male. Mm-hmm. And then within the article, I also have to balance that. If my main character is male, I really try that the expert is the other gender. Mm. So that even if someone reads my article, they don't end up reading the whole article with one gender voice.
Yes, yeah. So look, I think what's very important here is that both genders are important, but I think when it came to COVID-19, I think that we need to think clearly about some issues, okay? And one of the most important issues was around healthcare workers, okay? Healthcare workers were at the coalface. Healthcare workers are at the coalface, right? Which means that they were firstly at risk. Secondly, they bore the brunt of the pandemic because it was so urgent and there was a running out of all kinds of equipment, et cetera, et cetera. So all of that is important. And why do I say that? Because most healthcare workers are women, okay? So in some ways, if that story is not told, then there's a gender bias in this. So for me, it's very important, okay, that that kind of reflection is there in the stories. You've got to do stories about healthcare workers, because not only were they put at risk, but also remember they had to go to work. Okay, so it's also about money to get to work, no transport to go to work at the time when there were lockdowns, for example. That story needs to be told. Now, obviously, the story around men can be told about adding to the pot on the table. So all of these things become seriously important. And we need to bear in mind it's about who is doing the work, who is being affected. And because it's not trying to be discriminatory from one sex to the other, it just so happens that in most countries, women are at that coalface. They really are. And certainly in a lot of countries that from where we report from, okay, there are a lot of women that are single household runners, managers, if you like. And that story also needs to be told. So I think that's an important point to raise. Now, to be able to answer the other questions, I have 52 minutes and I've got 12 slides, and I'm just wondering, Toli, if I should go there quickly.
Sure.
So if we can maybe have a little 3 minutes past the hour. So this is what I have for you. Everybody, I just want to say thank you to Tebi, but I just wanted to share some of my thoughts that I had, and I'm going to race through it. So, but just to tease, all I want to do is to tease you, okay, about story ideas, because I think that was a question that came up, was like, how do we keep the story alive, and also issues around access. So let's just have a look at this very quickly. We're constantly looking for ideas as journalists, right? We have to, because that is our bread and butter. If we don't think of new ideas, we ain't going to make a living either, right? So some of the things that still remain exactly the same. Just in case you think that COVID-19 has gone away, it has not. The WHO, in a meeting, I think it was on the 8th of July, they say that COVID-19 remains a public health emergency of international concern. So it hasn't changed. And the reasons is that we'll know that the cases have gone up 30% in, I think, the last 2 weeks. And it's why? Because of those variants, the Omicron BA4 and BA5. So this slide shows you science has not stopped, okay? The pandemic has not stopped. There may have been places where everybody feels, oh, it's okay now, we don't have to wear masks, etc., etc. That can change. And as long as journalists understand that, we'll be able to inform our communities correctly. We are not the bosses here, okay? The virus and the variants are the boss. So what we need to do is we need to continue reporting as things are uncovered and as the science tells us. Another important point that I want you to look out for is second and third generation vaccines. What do I mean by that? First generation vaccines, those were made bearing in mind the original Wuhan virus, okay? Then what happened is that the variants came along and our vaccines suffered a bit in relation to preventing against the virus, all right? Because that's what variants do, is they try and escape, okay? So that we can't actually stop them from entering. So what's important here is that now scientists, okay, and I don't expect you to, know everything about this. What I expect you to do is I expect you to start looking at this as new story ideas. So second generation and third generation vaccines, these are new vaccines that are in development. They are going through clinical trials. And why are they doing this? Because scientists are wanting new vaccines that will stop all variants that are currently around, but also those variants that we haven't even seen yet, okay? So they're looking for the vaccines that will stop even emerging variants. Now, this is an area of science. We need to tell people out there, we've got to keep that notion of vaccines and the good of vaccines out in the community. And you do that by writing informed stories. COVID-19, long COVID. Have any of you done a story on long COVID? Okay. Well, if you haven't, and you think you might be interested in it, find somebody in your community that you think might be suffering from long COVID. Phone up doctors and find out, are there people that are portraying symptoms of long COVID? And then what do? We do a dive into asking a person who's got long COVID to explain what they are feeling. Have they done anything about it? Have they ever felt like this before? Is it connected to COVID? Because long COVID is an issue. It is a real issue. And just like Tibby was saying, she spoke to the person that eventually she got the story with the deaf lady. Well, find somebody who's got long COVID and do a story on it, and then you get your sources and you continue, and it could be a lovely story. Another major issue, okay, is poverty. Poverty. We've discussed the issue about rural areas. Tell the story about poverty. Tell the story about starvation. We had serious lockdowns. People are still trying to recover. What is the government doing about that? Okay, in our country, in South Africa, there were issues around grants. What I'm saying to you is you tell the story of people that are suffering. Okay, equitable access. Well, that's an ongoing issue, okay? So it's an ongoing story. The point that we now have is that we actually do have enough vaccines, but not enough vaccines are going into arms, okay? So there's an important reason for that, okay? And it relates to health systems. Many health systems in the areas that we report from are weak, all right? And that is why these certain governments are not getting their access to vaccines, because they're not putting their orders through, because now things have changed. Through COVAX, we have been able to get enough vaccines. It's now the governments in our countries that need to be working on making sure that the health system is ready to receive those vaccines and making sure that they're putting in the right orders. That is where the debate has changed. That is what you need to be following. A very, very important story. I know it's going to sound a bit over the top and highbrow for ordinary communities, but it's something that you need to be covering, because this is where huge battles are for access to COVID-19 vaccines. And it is the World Trade Organization. There is a committee, it's called TRIPS, okay? And this is not just about COVID-19 vaccines. This is about diagnostics. It's about treatment, not just for COVID-19. It's about for every health condition that you can imagine. And what it is about is that pharmaceutical companies that spend money on the research and design of, let's say, these pills, okay? So these pills, let's say, was developed by Adele Baleta Incorporated. Now, I paid the money to develop this. So now what I do is I say that nobody else can have access to this for the next 20 years. In other words, that you can buy it, you can pay me, all right? So I can make it any price I want. And because it's such a good drug, you will pay me. But no other manufacturing company can take the ingredients and make the same drug, all right? Now, that's a problem. That's a problem for our countries, for poorer countries, because it means that we can't get cheap access to this new, brilliant pill that's going to change a person's life. Now, at the World Trade Organization, South Africa and India came together to try and fight the fact that these manufacturers should not hold onto that patent or that license for so long. They need to make the drugs available to all. All I'm saying is you need to follow that debate. World Trade Organization, TRIPS, I think that Christophe put into the chat a story around this. Now, I'm not sure how much time we've got left. We're probably way over time already. I'm just going to really rip through this quickly. Health systems, guys. You need to track your health system in your country. Having a completely healthy health system, okay, is where people have access to drugs. They have access to the right diagnostics. They're not just COVID-19. I'm talking about everything. So we're talking about that story that Tebby and I were discussing, okay? It's like going to, what is that health system like? Has it reached the rural areas? Those are the stories you need to be writing about, COVID-19 or not, okay? So that's very, very important. I can't tell you more about that because of time. The other important issue is zoonosis, okay? So now we know, all right, is that like COVID-19, there's been so many diseases in the last couple of decades, the last 6 decades, that there's way more diseases than ever before. And most of these new diseases are caused by viruses that can jump species. They go from animals to humans, okay? And that's exactly what happened with the coronavirus. But it's not the only one, right? There are going to be more and more and more. So according to the World Health Organization, about 1 billion cases of illness and millions of deaths occur every year from zoonosis. That's when the virus jumps from an animal to a human. It is a very important area for you to talk about, because the thing is that zoonosis often happens in poorer countries. That's where it starts. And that is because people need to eat, and a lot of people eat wild meat. Okay, so this is an example of bats. I can't go into that in any more detail, but what it does raise, and this is another thing that you need to write about, it's about One Health. So we're not just writing about humans only. It's a very important area. This One Health is about animal health. Okay, so we don't want these viruses in these animals. Okay, so we need to be talking to the veterinary science field. Okay, there's also the issue then about human health, but there's also about environmental health. So, you know, the more deforestation that happens, the more that we have urbanization, the more that pressure is put on our environment, the more that humans live closer to animals, the more chance of the spillover of viruses. So this is another area that we need to talk about. And then lastly, pandemic preparedness. I spoke to you about health systems. You need to track your health systems on a daily basis, okay? It's very important. All of those issues that people have in terms of health, about non-delivery, about stockouts of drugs, stockouts of vaccines, all of these sorts of things. We are going to have another pandemic somewhere. And we need to learn, okay, from this pandemic about how we continue asking those questions. So in other words, is the health system up and running? Where are the problems with the health system? If another virus hits us tomorrow, are we going to go into absolute panic like we did with COVID-19? All right. Or are we going to be ready? And these are the kinds of questions that you can ask. There's a story right there for you. You can go straight to the scientists and say, I'm sitting in Kenya. I'm a journalist from Kenya. I'm from Zambia. I'm from Cote d'Ivoire. I'd really like to know about pandemic preparedness. What is it? Okay, so you use just the ordinary things. What is it? Why is it important? What have we learnt, okay, from COVID-19? Do you think that Cote d'Ivoire is ready for the next virus that hits, okay? Or what do we need to be doing? Story, boom, you got a story straight away. Okay, and then I just wanted to say there was Marburg, we've just heard about, okay, and then we've heard about monkeypox. So guys, strap yourselves in and get ready for the next ride. And the beautiful part of all of this is that you as journalists, okay, I think have learned, like I have, because I certainly have. I've learned so much in the last 2 years. My contact book has swollen from the number of people I've spoken to. I don't have to spend so much time looking for the right person to speak to anymore. So if you're feeling in any way, I don't know where to go, I don't know what to do, some of these ideas are for you. The pandemic is not over. Just keep doing what you've been doing and do it better. Thank you. And I'm sorry for keeping you over time.
Thank you so much, Adele. And all of our attendees have stayed with us, which I think is just a testament to how valuable of a conversation this has been. Thank you so much for all of your insights, and to Tebio Atenyo as well. Thank you. This was so informative, so engaging. We really appreciate you sharing your vast wealth of knowledge and experience with us today. So thank you as well to our attendees. This brings us to the end of another media dialogue. So there's been lots of questions in the chat. We will send you the recording of this dialogue. And as always, we want to hear from you, the attendees, about how you use the information gained today in your reporting. So you can send us your work so that we can track how useful these dialogues are. And please tell us what topics you'd like these dialogues to tackle in the future. So I want to say thank you so much again to Adele Baleta, to our special guest journalist, Tebi. Until next time, for Tole Nyata and the entire media working group, I'm Hannah Tellier saying thanks for joining us and stay safe.
Bye, everyone. Thank you. Thank you, Hannah. Thank you, Tole. Thank you, Christophe.